Hi, Dr. Sasse here from Sasse Surgical Group. So what is the cost of bariatric surgery? I've had some people ask me lately what goes into that cost, and then perhaps more importantly, what are hidden costs of bariatric surgery? I'm going to also tell you at the very end of this the number one most important thing that I think relates to the cost of bariatric surgery, which is how to minimize any hidden or exposure to extra costs. So we'll come back to that. But let's talk about what is the cost of bariatric surgery. You know, it can range. I've seen prices that range all over from, you know, as low as $5,000 or $6,000 or $8,000 up to as high as $25,000. What goes into that is typically 3 to 4 main components. Generally speaking, in the United States or the developed world, the largest share of that cost is going to be the hospital or the facility. That's usually in the neighborhood of 60% or more of the cost. And that's going to include their facility. They have a significant cost basis for their facility, any medications, drugs that are used, the nursing staff and all the support staff that's involved. If there's an overnight stay or a longer stay in the hospital, all of that derives significant costs associated with it. Next, there's an anesthesiologist, because you got to have that if you're going to have surgery. Those are the guys that make it nice and comfy while we're under surgery. That might be about 10% of the cost overall. There is going to be the surgeon, of course, and the surgeon may be getting somewhere in the neighborhood of 15%, or maybe if they've negotiated with their facility, it could be slightly higher. That's also typically going to include all of the costs associated with their preoperative evaluation, education, and then postoperative support afterwards. So that typically is all kind of going into that surgeon component. Lastly, especially in the United States and especially in accredited centers, there's going to be a way of reducing any exposure to hidden or extra costs for you if you're paying out of pocket for weight loss surgery, and that's a complications protection plan. It's like an insurance premium, and that's often another 10 to 15% of the overall cost. That is going toward that protection premium. That way you don't get hit with a big bill should you have some additional treatment required or more surgery required. So that generally covers the lay of the land. However, what hidden costs could there be? Well, if the program or the plan has kind of represented a portion of that, but they haven't laid out all of the costs, then you could find yourself getting additional bills along the way. When we were first establishing our program, we kept trying to find out where people were getting bills from. In this crazy world of surgery and the healthcare world, we found out that some of our patients were getting a bill that was coming not from the hospital, but it was coming from a separate group that read the pathology report on the stomach tissue which was taken out. And we didn't even know about that until a patient brought in the bill, and we had to go chase that person down and explain to them that this was a package price, and we had to get them to eliminate their bills. We've had to negotiate on about 20 different little silos in the crazy world of American medicine to bring all of those hidden costs under one umbrella and avoid people getting any bills of any kind that are unexpected. But if your program hasn't kind of done all that work, then you could be getting some sort of costs that you didn't expect, like laboratory studies, x-rays, EKGs, pathology report, an anesthesiologist, an assistant perhaps that you didn't know about. There could be a number of things that can lurk out there. But the number one thing that you want to do is to avoid any risk or exposure to a big cost or a hidden cost, and that's going to come from avoiding complications. This is the number one thing I can't impress upon you enough. And how do you do that? Well, you do that by choosing somebody who has the best track record, who has the best reviews, who is all in on their dedication to the safety of each and every patient, and who has a great track record, who has publications that support that. That's the way you minimize the costs of having a problem with the surgery. The worst kind of problem is typically a leak from any of the kind of operations. And even if you have a complications protection sort of plan built into your program, there's often no way of completely 100% avoiding the costs. You might have to travel, you might have to miss work, you might have to undergo more procedures, and even if the big bills are being mitigated, there's no way that you're going to be able to avoid all the costs that would be associated with actually having a problem or a complication like a leak that needs reoperation. So my number one piece of advice to anyone who is considering the costs of bariatric surgery is to carefully evaluate all the costs and the hidden costs, and then think most importantly about avoiding exposure to the biggest hidden cost, which is a cost of a leak or another complication. I hope that's been helpful too. I wish you the best success.